At this point, you may be wondering how you can best prepare yourself to participate in simulation. This video will provide some general guidance. Course instructors will assign specific preparation, instructions, and assignments, and may even provide you a video on how to prepare for the simulations for their courses. The first step in preparation is to read carefully all of the information provided by the course instructor and watch any videos they have assigned related to the simulation. As you prepare, take notes. You will be allowed to take your notes into the patient room with you. Open and read all charts, whether paper or EHR Go charts. Be sure you open the orders in EHR Go and scroll down to the details. Look up any medication orders for the patient and perform dosage calculations if needed. Look up any abnormal lab values or diagnostic test results from the chart and try to understand how they relate to the assigned patient's condition. Look up the patient's diagnosis and consider what assessments you will need to perform and any changes you might anticipate in the patient's condition. Think about what skills you might need to brush up on to provide care for the assigned patient. For example, if there is an order for an NG tube and you have not inserted one since your first semester, come to Open Lab and practice inserting an NG tube. Practice programming IV pumps for primary and secondary fluids. If you are assigned to a team or group for the simulation, it is helpful to do some preparation together. You each have to submit your own work, but you can discuss your understanding of the patient's condition, orders, lab results, and diagnostic tests. Some groups talk through how they will prioritize orders and how they will divide up tasks amongst the team. Some groups come to Open Lab and work through all of the orders together. Keep in mind, some teams may have students from the Libby campus. It is helpful to loop them into your discussions. Libby students have access to the Skills Lab in Libby to practice skills, or they can make an appointment to practice in the Kalispell Lab. On the day of your assigned simulation, arrive on time, dressed as you would for clinical, with your laptop, prep work, and assessment tools ready for a good day of learning. We understand that even though we have reassured you your simulation is not a test, nor is it graded, you may be anxious to demonstrate to instructors that you are prepared and competent. While we may not be able to alleviate all of your nervous anxiety, we want to assure you we will not expect you to do something you have not yet been trained to do, like deliver a baby on your own. We are not going to intentionally throw you any curveballs, though on occasion a simulator has a mind of its own and does something we are not anticipating. If this occurs, we will guide you through how to respond. Not every simulation is going to be a situation where a patient's condition deteriorates or where you will have to do CPR. It is our hope that the videos in this series will help alleviate some of your stress and help you prepare for your simulations. If you have questions, do not hesitate to reach out to the course instructor or simulation staff. We are here to help you.